So when we first started, we came into this thinking we were going to reduce antipsychotics. That was our goal on Skinner, and that is how we brought Adele in, because that was one of her concerns when her husband was a resident there. They came to the project. I wasn't on it at the very beginning, but we're told to forget the project. That's not what this is about. This is about changing the culture of safety within your home. So when we first came back, I went to learning session 2. And after we had reviewed the maturity matrix with our team, it was how do we build capacity to recognize harm? And that was a big aha moment for me. Was there's 8 types of harm. I think I was aware of 2, quite honestly. So if I'm only aware of 2, likely my teams are only aware of 2 or 3, right? So how do we start building that capacity? So our first step was to do that and create a process that really engaged our teams, and using our family rep to develop something to start having those conversations. And it gave us time to have those conversations. And then through that and hearing the feedback from our teams as what are the gaps in the current process. And a lot of those gaps had to do with accountability. How do we know that things have been followed up on, or we report concerns all the time and nothing happens? So we then worked with Adele to create a process that actually closed the loop on that and empowered our teams to take safety into their own hands. We always say it, but this time we actually gave them the tool to do that, gave them the freedom to make those changes. And that's kind of what we've been rolling with. And then working on developing how do we spread and scale that. So it's not just that I would have to go out, or Adele would have to go out, or any of our team would have to go out and expand this if other teams were interested. But how do we give them tools and then coach them through using it on their own? So that's kind of been our journey and where we are now.
Just identifying that there's more than 2 or 3 types of harm that can happen to the patient or to the staff member, right? And we just recently stole from Calgary last time and put together a flow chart for patients' families to identify who to contact if they have concerns. And for me, that is a really important part, because when I got there, it was like, who do I call? And now with this flow chart that we have, the issues are identified, the person to contact, their phone number, it's all there for the patients and the patient families. So to me, that's a big change right there.
Change is hard. So one of my favorite books is called Change is Hard, You Go First. So nobody really wants to change. Everyone likes to talk about change. So that's been a huge part. And I think what was so great about the framework is it gave us that time for change, because culture change isn't quick. So even for the first 6 months, all we did was talk. And we spent time talking to our teams and having them give us examples of what they've seen in their workplace. So that was a huge challenge to overcome, was just how do we get people realizing that this is not just a pet project, not just, like we're gonna do this for a couple months. This is the way we want everyone to be thinking about, presence of safety rather than the absence of harm. So that's been a huge challenge that we've been overcoming, and I think it's still going. I don't think we can ever say, yes, we've successfully changed the culture. I think it's an ongoing process, and it will always be evolving as we hit different blocks within healthcare.
One of the most important things is that the patient's voice has been heard, right? You can have concerns, and if something hasn't been done about those concerns, you feel like you haven't been heard. So that's one of the things, is that your voice has been heard. And on this particular project, I feel that my voice has definitely been heard. So that's been valuable to me. And I think our next step is to contact other present patients and their families and find out their concerns, and have we mitigated any of their concerns along the way as we've worked through this. Just knowing things like when med changes are made, that the family is contacted before those have taken place, right? You need to know what is your loved one on now as compared to before.
We've been really fortunate to partner lots with our communications team to get the word out about the work that we're doing. So even just having our feature on the SHA Facebook page, actually had one of the care aides from CAMSAC reach out to me to say, we want to learn more about this. So it opened up that communication to say, so instead of me coming to them and saying, I'd like you to do this thing or be one of my teams or whatever, it was them coming to me and saying, tell me more about this. So it allowed us to branch out without having to I hate the word buy-in, I totally agree. To get that though, they came to me like craving that change, and I think that was exciting.
The support for me came in the team having me involved in the discussions that led to changes, not being there after the discussion, where it would be, oh, I think you should have done this a little different. I was there to throw that idea in as the ideas were being formulated, as the plan was being formulated. And that's where it's important to be, not an afterthought, but to be part of that forethought that happens.
It has given us the avenue to really focus on safety in our daily huddles. So we maybe had daily huddles before, but what were we talking about? Were we just talking about past harm? So this has really given us the tools to not only talk about past harm, but the other parts of the framework too. And as Adele said, we used her input to create a process to guide our teams through having those conversations and ensuring that's happening daily, that we're not only talking about past harm, but we're talking about, potential for harm. What are we going to do about it? What are the actions we're going to take? And how are we going to know that they worked? So I think that's a really exciting that we've been able to really put that right into the everyday work. So when we get back creating a plan for the next 12 months, where do we want to go? We've already seen some scale and spread, so how do we keep that going? And I think it is going to be strong leadership is so huge. And right here in this group, we have everyone that's on board and sees the potential of this. So holding each other accountable to make sure that we're taking these actions forward, to keep it going on our units, hold everyone to using the framework, working with our patient safety department, who's also finding value in receiving the 5I form, which we created, and helping them with their work. So when everyone sees value in the work that's being done, it's a little bit, I wouldn't say easy, more simple to sustain because it's not added, right? They're seeing the value of doing the work. So I think it's just as long as our team is really on top of it and everyone keeps taking those opinions from our families and our staff. And we've done, I think, 7 different variations of this form as we went through. So continuing to PDCA to make sure that it's still value add for our team so that it doesn't become redundant. We want it to be always evolving. I think it was really great that we also had huge support from our leadership. So we weren't in this by ourselves. We had our board really supporting us on this. We had our executive leaders supporting the work. So we didn't feel like we were going against the tide. We are going, in the right direction. I think it's the right work. It's not easy work, but it's the right work. So I think having that leadership support in our journey has been huge because it hasn't been easy, right? You always hit those roadblocks, but knowing that you had someone else to go to help you remove or eliminate roadblocks was huge.
I don't think this would have moved forward without Christina and Danielle. I have worked with others, and the speed at which things have unfolded is incredible, and it wasn't like that in my previous experience. The piece that really resonated with me was that this horrendous experience that I went through had some value for other people.